And now I want to talk a little bit about this. This isn't necessarily a study, but this is some research related stuff. I had a passion for health and fitness for a long time, and one of the people that I've really admired over the years is Chris Kresser. This guy's an expert in functional medicine and paleo or ancestral nutrition. His focus is on alternative health based on scientific evidence. This is the kind of stuff that's curing people from diseases that traditional health experts say can't be cured. Some of you guys listening probably think I'm crazy, but it's something I do believe in. I highly recommend listening to Chris Kresser's podcast and reading the stuff that he publishes on his website. But anyway, he was on the Joe Rogan podcast last week, and he talked about a lot of great stuff. If you want an hour and a half of eye-opening information about health and nutrition, go have a listen. But one of the parts that really caught my attention was a discussion about the corruption of the pharmaceutical industry. So this is about 45 minutes into the video. You'll find that on YouTube. But he talks about how there are some real problems with how science is conducted today. And they also talked about things like who's funding some of these drug trials on pharmaceutical drugs, the efficacy of those trials, and how these companies are profiting from it. So Chris Kresser, he mentions that 2/3 of medical research is funded by Big Pharma. He quoted Upton Sinclair, who said, "It's difficult to get a man to understand something when his salary depends on him not understanding it," which explains a lot about the results of many studies we see in or out of the vaping industry. He also says that it's just basic human nature. Even if it's not conscious, it's subconscious. So if you're a researcher being funded by a pharmaceutical company and you know that your results are negative and don't support that drug that you're doing the test on, you're less likely to get your next project funded. So that could have something to do with the way study results come out. Chris Kresser, he does mention that most researchers, or he believes that most researchers are good people trying to do the right thing, but it's just the way that the system is set up that creates these problems. Because these researchers, they need to depend on pharmaceutical companies for their funding. And that can really end up skewing the results of a study. Something else he mentioned, which I never knew about, was that up until just recently, pharmaceutical companies were not required to publish negative results. So if it turned out that a placebo was more effective, or that the drug had side effects that made it not usable, that data didn't have to be published in the study results. From what I understand, from what Chris Kresser said, that has been changed recently, but that doesn't change anything from the studies that have been published in the past. So a lot of the studies that we know about now that researchers are still using might be missing pretty crucial data. He also mentioned fraud. So one of the examples he gives was that there was a study published in the Journal of American Medical Association. A guy named Charles Seifert looked at the FDA monitoring of drug trials. One of the jobs of the FDA is to make sure that drug trials are done the way that they should be done, which means making sure that no patient data is falsified, things like that. So what Charles Seifert found was that in 96% of cases where the FDA found fraud, the action of fraud that those researchers acted in was not reported in the study results. And another case he gives here, researchers changed patient data to hide the fact that the patient had prior liver and kidney problems, and they gave this guy chemotherapy treatment and he died. The researcher spent 6 years in jail, and this was never mentioned in the study that was published. So one really good example of how this can really be dangerous is an example that Chris Kresser gave. He mentioned that there was a trial for an anticoagulant drug, and the FDA found that the testing center falsified patient data and change the results. Well, because the FDA didn't require that this data was taken out of the study results, it was included in the final study. If this false data was taken out of that study, that drug would have failed and would not have been more effective than a placebo. But since the FDA didn't require that data be taken out, it was published with it, and studies that came out even 18 months later or longer have been using this study with that falsified data in their own studies. And these research teams that are using this original study as the basis for their study have no idea that the data is not true or accurate. And doctors all over the world are using the results of this original study and the other studies using that same data to make decisions on whether or not to prescribe these drugs to their patients. So very, very dangerous stuff. And then he talks a little bit about the peer review process. So here's another example he gave. There was a big study where a paper was submitted to the British Medical Journal, which is a major medical journal. And the study that was submitted had 8 major errors. They knew that it had 8 major errors. Not a single scientist of the 221 scientists who peer-reviewed that paper found all of the errors. Only 30% of them recommended rejecting the paper, and half of them were warned in advance that the paper would have all of these errors. And even those scientists who were warned about these errors, they didn't find any more errors than the guys who didn't know about the errors. So peer review is a major part of the scientific method, and it's not working. And that could mean that in a lot of cases, a lot of the findings that we take to be true and valid are not actually true and valid. And here's another example of something wrong with the system. The Open Science Collaboration, they did a review of 100 psychology studies that have never been validated and tried to replicate them, and they could only actually replicate 35% of them. The other ones in an exact same or as closely similar situations as possible to the original study, they couldn't do it. And it has actually been found to be happening in a lot of studies where they're not actually being validated. And in Chris Kresser's words, he says, whole fields of research is built on studies that can't be replicated. And then another thing he talked about was that another issue that many studies have are that they're not performed long enough. So there have been many studies that showed positive results over 2 weeks, for example, but that's not applicable to the way we live our life. If you perform a study over months, years, or even decades, you see whatever has been shown to be positive in the short term ends up being negative in the long term. This doesn't necessarily happen for dishonest reasons. A lot of times it's simply because studies are extremely expensive and become much more expensive and more difficult to control the longer the study is. So yeah, basically there's just a lot of problems with how studies are being done. Studies are important and many are done well, but a lot of these issues just shows that you need to be cautious about all of the scientific research that you read, good or bad. And the reason I bring this up is because there is so much research coming out in regards to vaping, and I just think it's important for everyone to keep a lot of these things in mind.